What is a biomarker? A biomarker is any measurable indicator of the state of a body, like TSH. When this pituitary hormone is produced less in the body, it shows certain symptoms, and thus it indicates that there is an underlying disease which needs to be addressed. Hence, TSH is a measurable indicator, and that is a biomarker. Let's see the different types of biomarkers. First, we have prognostic biomarker. This biomarker suggests the likely outcome of a disease an untreated patient can have. And the example for it is BRCA1 and 2 genes, which are biomarker for breast cancer recurrence. Next, we have predictive biomarker. Like its name suggests, predictive biomarker predicts the degree of benefit a patient can have from a certain treatment. Predictive biomarkers are also helpful to evaluate the treatment option which is best for a patient. And the example of predictive biomarker is HLA genotype. HLA genotype is a biomarker for HIV patients, and it is used to assess before going on ahead with abacavir treatment. Abacavir treatment is for HIV. And then next we have a safety biomarker. Safety biomarker is measured before and after a patient is exposed to a drug or a certain treatment to see if the drug or the treatment has any adverse effect or toxicity in the body. The example of safety biomarker is serum creatinine, and this is a biomarker for patients who are on drugs which can affect kidney or to monitor nephrotoxicity. The next biomarker is susceptibility or risk biomarker. These biomarkers measure to indicate if there is a chance of increased or sometimes decreased chances of developing a certain disease later in life. And its example is LDL levels. And we all know if the levels are high, then there is chances of developing coronary artery disease later in life. The next biomarker is diagnostic biomarker. This biomarker indicates or confirms the presence of a disease in an individual, or it is also used to evaluate the subtype of a disease which can be present in an individual. And its example is HbA1c, which is a biomarker for type 2 diabetes mellitus. And the last biomarker is monitoring biomarker. A monitoring biomarker is used to assess if there is progression of disease, if there is change in severity of disease, if there is any improvement, or if there is development of new disease before and after exposure to a medical treatment. And one of the example is HCV RNA levels. These levels are used as monitoring biomarkers to assess patients with chronic HCA levels after treating them. That's all about biomarkers.